Okay, I am an independent infection prevention consultant, and I'm hired by Metrex as their infection prevention advisor. By the end of this presentation, you should be able to describe the contribution of hand and fomite contamination to HAIs, recognize the risk of organism transmissions in healthcare settings, explain the purpose of hand hygiene and non-sterile glove use, and discuss the importance of environmental cleaning and disinfection in preventing transmissions. Now, modern healthcare uses many types of invasive devices and procedures to treat patients and help them get better. Unfortunately, every year in the United States, about 2 million people get an HAI while they're being treated for other health problems, and almost 100,000 die. And HAIs add billions of dollars to healthcare costs annually in the US, yet they're the #1 preventable cause of death. So at this time, Molly, can you run that first poll, please?
Absolutely.
Okay. This will be interesting. Hospital yourself and had a loved one or friend hospitalized. Lucky you, the 3% with none of the above. Yay. So the reason I ask this is because what I'd like you to do is think about that experience that you had, for those of you who've been in our healthcare system or had friends throughout this presentation, and think about what that was like and how you felt at the time. So keep that feeling going. Okay, so you can find many of these HAI pathogens on surfaces, equipment, and hands throughout healthcare settings. And knowing all that we know about hand hygiene, cleaning and surface disinfection, modes of organism transmission, and their connection to infection, why do we continue to struggle to contain their spread? As an IP, we're all supposed to know about the chain of infection, and I read about it a really long time ago when I was studying for the CIC, but no one really explained it to me, and I think it's worth revisiting. Now, this chain of infection involves several steps, and each of the steps must be in chronological order for an infection to develop. So think of each step as a link in a chain. Okay, the 6 links in the chain are the infectious agent or the organism which can cause disease. And infectious agents can be bacteria, viruses, fungi, and parasites. Now, their virulence depends on their number, their potency, their ability to enter and survive in the body, and, very important, the susceptibility of the host. Second is the reservoir, which can be a person, an animal, really any object in the general environment, even food or water. So that infectious agent depends on the reservoir for survival. Third is the portal of exit, or that infectious agent's way out of the reservoir. So for a human reservoir, the portal of exit can be blood, respiratory secretions, and anything exiting from the gastrointestinal or urinary tract. So think sneezing, coughing, diarrhea, and vomiting. Fourth is the mode of transmission. And this is how organisms are transmitted from one person or place to another. This could be on someone's hands, on an object, through the air, or bodily fluid contact. Fifth is the portal of entry, and that's really any route that infectious agent uses to enter another person. So this could be landing on a mucous membrane, it could be being breathed in or entering through a wound or an invasive device. Now, what's interesting is that pathogens tend to enter the body of the host through the same route they exited the reservoir. So pathogens from one person's sneeze can enter through the nose of another person. It's kind of cool. 6 is the susceptible host, and that is the person who is vulnerable to infection. And we know that infection doesn't occur automatically when the pathogen enters the body of a person whose immune system is functioning normally. But if it enters an immune-compromised person, infection can occur. So if some action can interrupt a step or break a link in the chain, then it's possible to stop or reduce the spread of disease. Now, this is how we break each link of the chain, stopping the infection. For that infectious agent, I know you like my lightning bolts, we practice appropriate diagnosis and treatment, especially antimicrobial stewardship. For the reservoir, we initiate cleaning and surface disinfection, sterilization, and pest control. For that portal of exit, we break out more of our infection prevention and control practices like hand hygiene, PPE, respiratory etiquette, and environmental controls. Now, we break that mode of transmission by performing hand hygiene, using PPE, initiating and maintaining transmission-based precautions when indicated, cleaning and disinfecting the environment, and cleaning and disinfecting or sterilizing equipment used by more than one patient, and also keeping food safe by cleaning, separating, cooking, and chilling food to protect it from causing disease. Now, we break the chain at the portal of entry with hand hygiene, PPE, personal hygiene, providing first aid for wounds and removing those invasive devices. And for the susceptible host, we vaccinate, we treat any disease, we educate on those diseases, and we encourage health insurance to help ensure health issues can be addressed before they become a serious problem. Now, breaking the chain at the mode of transmission is one of the most important ways to interrupt the spread of infection. And this is where infection prevention and control strategies can be most successful. Now, in that chain of infection, the mode of transmission is important, and we're going to look at contact transmission. And contact, we have direct and indirect. Now, direct contact is when disease-causing microorganisms pass from an infected person to a healthy person by direct physical contact with blood or body fluids. So think touching, kissing, sexual contact, contact with oral secretions, or contact with body lesions. And examples of direct contact diseases would be HIV, hepatitis, scabies, and MRSA. So we also have direct droplet, which are large, short-range sprays or aerosols produced by sneezing, coughing, or even talking. So transmission for these requires close proximity. Examples of diseases spread through droplet transmission are the common cold, rhinovirus, influenza, pertussis, and meningitis. Next, we have indirect contact, and that's when pathogens are transferred between people by a contaminated intermediate person, object, or environmental surface. There is no direct person-to-person contact. So indirect includes airborne, which are infectious agents carried by dust or very small droplet nuclei that travel farther than droplets, and they can remain suspended in the air for long periods of time, where they're distributed by airflow and inhaled. So some diseases spread by airborne transmission are chickenpox, measles, tuberculosis, and COVID-19. Next are fomites. A fomite is an inanimate object or an environmental surface that can carry and spread disease and infectious agents. And fomite transmission is usually associated with respiratory and gastrointestinal diseases. So some infections transmitted by fomites are RSV, rotavirus, norovirus, and C. diff. And last, we have our vectors, which are living organisms like mosquitoes, ticks, and sandflies that transfer pathogenic microorganisms from their bite. Now, vector-borne diseases are transmitted from human to human or from animal to human through an arthropod, like a mosquito or a tick. The organism must pass through that vector before it can infect humans. And examples of vector-borne illnesses are malaria, Zika, West Nile, plague, which we've heard about recently, Lyme disease, and Rocky Mountain spotted fever. So direct transmissions can be interrupted by preventing contact with the source, and indirect transmissions require different approaches like adequate ventilation, cleaning and surface disinfection, proper food storage and handling, or the use of mosquito nets and insect repellents. Our hands carry on average 3,200 different bacteria belonging to more than 150 species. Hands make organisms mobile, and fomites provide a place for organisms to hang out after hands have touched them. And we touch things all the time, but don't realize it. So think about that person at the deli counter that touches their face with their gloved hands, then slices your meat. Or the healthcare personnel that touches their face with their gloved hands or their bare hands after touching something in the patient environment. I'd like to share a few of the germiest things we touch to help tell the story of the connection of hands and fomites to possible infection. Now, at my gym, there's a guy who's thoughtful enough to bring his own towel to wipe down the equipment after he uses it. But the problem is he always blows his nose in it, and then he wipes the equipment down. So talk about direct contact. Ugh. The average mobile phone user touches their phone over 2,600 times a day, and it goes with you everywhere, even in the bathroom. And you in the audience, you know who you are. So it could be up to 10 times dirtier than a toilet seat with E. coli on it. Sponges and dish towels, they're the dirtiest things in your kitchen. They're packed with bacteria because they're used repeatedly. They get wet and they transfer organisms between the sponge and towel to your hands. Salmonella and fecal bacteria are often found. Money, you handle it with your germy hands, and so do other people. Some people lick their fingers when they count out bills, and most dollar bills are covered in 3,000 types of bacteria, most of it fecal. Your purse, you carry it with you almost everywhere. You stick your hands in it all the time. You leave it on the floor, dirty counters, bathroom stalls, and car floorboards. Staph, Micrococcus, Bacillus, and Enterococcus have been found. Birthday cake, I never thought about this one. Everyone who blows on the cake sends out bacteria. One study showed the number of bacteria on the cake surface increased by 1,400%. Then we have menus and condiments, my personal favorite. Some have 100 times more bacteria than a toilet seat. And even though tons of people touch them, most only get wiped down once a day, if that, and usually with the same dirty rag used to wipe the table. Staph and E. coli have been found on menus and condiments because they're passed from hand to hand. Now, I could go on and on. Healthcare environments are even more challenging. There's lots of objects, equipment, surfaces, colleagues, and patients that can expose you to an assortment of organisms. One study showed that a third of elevator buttons in healthcare are contaminated with MRSA, E. coli, and Acinetobacter. How about stethoscopes? Fortunately, they're used on unbroken skin, so the chance of infection is low, and that's good because studies show only 5% of doctors clean their stethoscopes regularly. Lab coats, we all know about this one. In one small study, Staph aureus was found on 23% of the coats, with MRSA also being recovered. And then phones, especially those mobile unit phones, those Cisco phones. Researchers found that they're covered in bacteria, including multi-drug resistant types. And in one study, a 1-minute phone call was long enough to transfer germs to hands that were previously cleaned. And touch screens, well, they're touch screens, right? So one study found fecal bacteria, Staph aureus, and MRSA. And really, anything in the patient environment is probably contaminated. So I think you get the picture now. We touch before we think about what we're touching. We don't clean our hands or change our gloves as often as we should. We're not aware we even do these things, yet they can have consequences. Everything you touch has probably been touched by someone else. Hands are a definite connection to infection. Okay, Molly, let's run our second poll. So, do you think disregarding appropriate infection prevention and control practices like hand hygiene, glove use, and cleaning and surface disinfection is intentional? Pick one. Most of the time, some of the time, never. Some of the time, good answer. Okay. Intentional most of the time, that's interesting. And then it's never intentional. Okay, that's good. One thing to understand is, just like I said, we touch things and we're not even aware of it. So I want to show a short video clip. I hope I can do this without messing it up. Here we go. Okay. So what a great video, right? Could you hear that groovy music? It was kind of annoying. Did you notice anything? I certainly hope so. Okay, organisms are everywhere in the environment, even on normal looking surfaces or skin that might not look dirty. We never really see the consequences of our actions or simply don't connect touching something with the possibility of causing contamination or infection. So how can we create more awareness? All right, I'd like to share a story with you. I recently had a family member in the hospital, and she had no previous hospitalizations and wasn't colonized with anything prior to this hospitalization I'm going to talk about. Over the course of prolonged and frequent care at several acute care facilities, she acquired quite an impressive list of MDROs. She was on transmission-based precautions at every healthcare facility she was admitted to, and she did transfer back and forth several times. So when I visited her, I would mention to the staff that I was an IP. Now, needless to say, not only was I visiting, but I was also observing all the healthcare personnel interactions in the room. And here's what I saw. I mentioned she was on contact precautions, but often there were no gowns in the PPE cabinet. Healthcare personnel at one facility told me to steal one from the cabinet down the hall. At another facility, healthcare personnel told me, family don't have to wear the PPE, just wipe your hands when you leave. She had VRE, MRSA, and CRE at this facility. No facility had instructions on how to put on a gown and no signage indicating performing hand hygiene before or after gloving. So any visitor wouldn't know how to do this unless instructed or had some visual cue. Now, her husband visited every day, but no one instructed him on how to wear the PPE or the importance of at least performing hand hygiene when he removed his gloves, if he had them on, which he admitted he usually didn't. Most healthcare personnel didn't perform hand hygiene before putting on gloves. Some did perform sort of I call it a slap and dash version of hand hygiene after removing their gloves and leaving the room. But their glove doffing was pretty bad, and I guess most contaminated themselves. I really wish I had some paint handy. Now, unfortunately, the majority put on their gown and gloves, then reached under the gown for a pen or their personal phone or something they realized they needed after putting on their PPE. Generally, they touched the computer, the counter, the bed rails, then the patient. Something else was touched before they touched my family member. Almost everyone removed their gown and gloves at the bedside, and some performed hand hygiene using the patient's sink, which was at the bedside, which was also next to the toilet. An attending entered the room, didn't perform hand hygiene, didn't wear gloves or an isolation gown. I wish I had a photo. She sort of wrapped the gown around her neck like a scarf. It was truly glamorous, but not very effective as a barrier to transmissions. She touched the bed rails, my family member's legs, which had multiple deep decubitus ulcers, and her bed linens. She then went over to the computer and typed a few things, then reapproached the bedside to talk for a moment, leaning on and touching the bed rail, then touched all the IV sites. She removed her gown from around her neck at the bedside, wadded up against her lab coat, and walked out of the room. No hand hygiene, on to the next room. Now, one unit my family member was on was having trouble with transmissions. Really? Okay, I admit it took me a while to get my bulging eyes back in my head. And I understand staff are busy, and it's not really their job to instruct visitors, and they absolutely do the best they can. And I'm not blaming anyone. I'm just sharing what I saw. Everyone was doing their job, and my family member was not their only patient, but probably one of many. Their task lists were probably pretty darn long. My point is, every interaction has consequences. When healthcare personnel enter a patient room, the first thing they should touch after performing hand hygiene is the patient. If you touch something else before touching that patient, perform hand hygiene if you're not wearing gloves, or change those gloves. Now, according to the World Health Organization, transmission of healthcare-associated pathogens from one patient to another by healthcare personnel hands requires 5 sequential steps. And the first is that organisms are present on the patient's skin, or there have been shed onto the objects immediately surrounding the patient. The second is that those organisms must be transferred to healthcare personnel hands. The third is that those organisms must be capable of surviving for at least several minutes on those hands. The fourth is that hand hygiene by that healthcare personnel must be inadequate, entirely omitted, or they're using a product that's inappropriate. And the fifth is the contaminated hands of that healthcare personnel must come into direct contact with another patient or with an inanimate object that will come into direct contact with the patient. Now, as you saw in the video, 80% of infectious diseases are transmitted by unclean hands touching contaminated surfaces. Hand hygiene is the cornerstone of infection prevention, but typical adherence in healthcare settings is only between 40 to 48%. We need to be aware that organisms can be everywhere, most likely hitching a ride on our hands. Now, we've all heard about the 5 moments of hand hygiene from the World Health Organization. The first time to perform hand hygiene, according to them, is before touching a patient. And why? That's to protect the patient against microorganisms from the hands of that healthcare provider. The next opportunity is immediately before a procedure. And that's to protect the patient against microorganisms from entering the patient's body, including their own organisms. Steps 3, 4, and 5, we perform hand hygiene to protect healthcare personnel and the healthcare environment from becoming contaminated with the patient's microorganisms. So these 5 moments are sort of the gold standard for performing hand hygiene. Some agree with them and some don't. And you can find the pros and cons if you search the literature. There's quite a few papers out there. Whichever side you're on, I think it's important to know what those 5 moments are and understand the why and the when of them. Now, I've broken these 5 moments down and included the when you should perform them. I'm not going to go through them because I just don't have time, but I wanted you to have them and see how specific they are. They're included in the resources section of this slide deck. Now, I think we all know the importance of hand hygiene in each of these situations. Do we actually do them? Not based on my experience with my family member, and not always as indicated. Can we actually do them? I honestly don't know. So how can we raise awareness of their importance when performing these daily healthcare tasks? So let's talk a little bit about gloves. The World Health Organization has 2 main reasons for us to wear gloves. The first is to reduce the risk of contamination of healthcare personnel hands with blood and other bodily fluids. And the second is to reduce the risk of organism spread to the environment from that healthcare worker to the patient, as well as from one patient to another. So we use them to protect ourselves so we don't get anything on our hands, but also to protect patients and the environment. That patient we're currently caring for and the patients we'll care for afterwards. Now, there are lots of studies that show gloves are effective in preventing contamination of healthcare personnel hands, and they help reduce transmission of pathogens in the healthcare environment. Gloves aren't required for routine healthcare activities where contact is limited to intact skin, unless transmission-based precautions are in place or there's some kind of an outbreak situation going on. But hand hygiene should be performed prior to touching the patient. Gloves are part of standard precautions where you might contact blood, body fluids, non-intact skin, and mucous membranes. Gloves are task-specific and single-use for the task. Remove them and perform hand hygiene when that task is complete. Gloves do not replace hand hygiene. Now, improper glove use has been linked to transmission of pathogens, and the connection is clear. Using gloves contaminated by inappropriate storage, inappropriate moments, and techniques for putting them on and taking them off can also result in organism transmissions. Healthcare personnel don't always disinfect their hands before they put them on, and we assume that a glove stored in a glove box in the patient room is low in contamination when we put it on, but not always, as we saw in the earlier video. It's known that glove box contamination generally increases the longer they're open. And when you think about this, isn't it a potential patient safety issue? A 2008 study isolated MDR Acinetobacter from gloves stored in a patient room that had a previous patient with MDR Acinetobacter. So gloves can serve as a reservoir for harmful microorganisms. Now, let's look at another short video.
Hallo. Jag tänkte jag skulle ta oss och se lite på storleken. Så bara ta på två avsnittningar.
That looks like it hurt. Watch it often.
Ja, det är lite. Så det låter lite så där. Nej. Ja. Gärna.
Okay. So, after watching these videos, you've probably gotten the idea that touching anything before touching a patient can be a source of organism transmission. So somehow we have to remember that anytime we touch a patient or a body fluid or come in contact with the patient environment, like the drawer handles, those supplies in the drawer, the bed rails, and the next patient, we have to make sure our actions don't spread organisms. We have to think, what was I doing before? How much contamination of my gloves occurred at the time? Do I need to change them, perform hand hygiene, then put on clean gloves before I touch something? Gloves don't completely protect against hand contamination. Pathogens can get on healthcare personnel hands by small defects in gloves or by contamination of those hands during glove removal. That's why hand hygiene is needed after glove removal. I've been in healthcare for a pretty long time, and I've never been trained on how to remove gloves from a glove box or trained anyone else on this. Have you? Maybe it's time we did, since most healthcare personnel skip hand hygiene prior to gloving. We should also train healthcare personnel how to don and safely doff gloves to reduce hand contamination. Have them demonstrate they can do it safely. No flicking or snapping. This is the sure way to contaminate the environment, yourself, and your colleagues. I am a huge fan of using fluorescent gel applied to gloves prior to doffing to show personnel hand contamination during doffing. And maybe we should also train healthcare personnel to not roll their gloves in their hands to loosen them up. And don't let them blow into them to make them easier to put on. Both of these actions can contaminate the glove. And how many of you know this? Hand contamination increases when gloves are too large due to increased exposed surface area. You've probably seen or used those floppy fingers or ballooning cuffs. IPs, you should consider ongoing observation of glove use, donning, and especially doffing with immediate performance of hand hygiene following that doffing. This is how we lessen contamination for the contamination to the patient and the environment, unless those gloves are contaminated too, like in that earlier video. Now, thanks to the paint in both videos, we saw contamination very easily. In real life, contamination isn't as apparent. We do things without thinking, and we never see the consequences of our actions. My point is, every interaction has consequences. We've seen that in the videos today. When healthcare personnel enter a patient room, the first thing they should touch after performing hand hygiene is the patient. And remember, gloves absolutely do not replace hand hygiene. So let's talk about surfaces a little bit. An estimated 20 to 40% of HAIs have been attributed to cross-contamination from the hands of healthcare personnel that are contaminated from either direct contact with patients or by touching contaminated healthcare surfaces. This transfer of organisms from these surfaces to patients is largely by hand contact. Remember, because hands are what make these organisms mobile. Now, pathogens can survive on surfaces for long periods of time, especially if cleaning and surface disinfection aren't performed or aren't performed adequately. Many organisms are continuously shed or spread by direct skin contact onto those surrounding environmental surfaces. And while we spend a lot of time on those most touched parts of the patient room, cleaning them and making sure they're disinfected, they can be recontaminated again and again due to healthcare worker hand contamination, or maybe we didn't even do a good job with cleaning and surface disinfection. So that combination of high touch and high contamination can lead to cross-contamination, which can lead to infections. Now, this infographic shows some high touch surfaces and the organisms they can be contaminated with. And you can see there's some overlap between most touched and most contaminated. So we tend to focus on high touch surfaces, making sure we clean and disinfect them. But what about the other surfaces? I think the thing to remember is if it's a touch surface, it's important. And my point is all surfaces are important in the patient's environment because it's clear that the environment is part of the chain of transmission. Don't assume things are clean, assume they aren't. So although hand hygiene is important to minimize the impact of organism transfer, cleaning and disinfecting environmental surfaces is fundamental to reduce their role in HAIs. Now, we assume that if everyone does a better job cleaning and disinfecting, that HAIs could be eliminated or reduced, but the data shows that's not the case. Patients who occupy a room where a previous patient had an HAI have a 25% chance of acquiring the same infection as that patient. This is despite our best efforts to follow required protocols for cleaning and disinfecting the room. Just like hand hygiene and glove use, we're not always aware of what we're doing because we're so focused on just getting it done and moving on to the next task. And not everyone follows protocols or procedures as they were intended. On one of my units, we were working to contain Candida auris, At that time, bleach was the only available disinfectant effective against it, so EVS was instructed to use bleach wipes. Now, I happen to be on the unit, and I watched an EVS worker walk into a room ready for terminal cleaning and use the regular bucket of disinfectant that wasn't effective against C. auris. So I asked her why she wasn't using bleach, and she said it was because she had to go to her manager, which is all the way down in the basement, to get bleach, and she just didn't have time to do that. So her focus was getting that room clean and disinfected, not on using the required product. And she didn't understand the potential consequences of her actions. Now, another time, I watched an EVS worker applying disinfectant to a patient mattress and then immediately wipe off the disinfectant on the mattress with a paper towel. Yet from the doorway, I could see big globs of mucus visibly stuck to the mattress. So when I talked to her, she told me she had about 5 more rooms to turn over and it was getting close to her lunch break. She wasn't even aware there was that goo still on the mattress until I showed her. She was distracted and not focused on the task in front of her because her to-do list was too large. So how do we get healthcare personnel responsible for doing the work to focus on the job at hand? Now, we all know an effective EVS program should prevent the environment from becoming a reservoir for microorganisms. And there's a really nice cleaning toolkit on the CDC website. It recommends our environmental hygiene program have regular cleaning schedules, specific, thorough, and effective cleaning methods, written policies and procedures, appropriate cleaning agents and equipment, education and training of EVS personnel, and really of anyone who's doing any cleaning, a method to monitor the thoroughness of that cleaning, and that infection prevention and control and EVS should partner with each other and other stakeholders for success. But even with all these things in place, we're still unable to get healthcare personnel to understand the important part they play in the connection to infection. Now, one thing I want to talk about is cleaning. And cleaning is the physical removal of foreign material and organic matter using water, soap, or detergent. But one thing to understand, it doesn't kill microorganisms. It simply reduces their numbers. It makes surfaces safer to handle or use. Now, cleaning should include the mechanical action of scrubbing or elbow grease, as demonstrated by this woman on the slide. It's hard work, but probably as important, if not more so, than any antimicrobial effect of the disinfectant. And what is a disinfectant? Well, it's a chemical that destroys or inactivates bacteria, fungi, and viruses, but not necessarily spores, on inanimate surfaces. EPA-registered hospital disinfectants are what you should be using. And understand that cleaning and surface disinfection are 2 separate processes. Cleaning with mechanical scrubbing leads to better disinfection because now that disinfectant can actually touch the surface of the object you want to disinfect. Think of it this way. Cleaning removes the crud, so disinfectants can kill the organisms. Now, the COVID-19 pandemic has changed healthcare quite a bit. There are staff shortages, increased patient loads, higher acuity, longer stays, and more burnout and stress. Healthcare personnel admit their task list is long and never ending. Things get missed, sometimes intentionally and sometimes not, as we learned from our poll. We've seen and talked about examples of not really understanding the consequences of our actions, lack of hand hygiene, improper use of gloves, touching things in the environment with contaminated hands and gloves, improper cleaning and disinfection. So I'd like to talk about 2 concepts, and the first is mindfulness. So mindfulness is the quality of being present and fully engaged with whatever we're doing at the moment. Now, I know it sounds sort of new agey, but it's been around for a long time with origins in ancient Chinese medicine. Now, Fortune 500 companies like Google, Procter & Gamble, Aetna, Facebook, and General Mills have been implementing large-scale mindfulness programs over the past few years with much success. The thing about mindfulness is that it sort of offers a pause or like a reset an alternate way of seeing ourselves and our environment by stepping out of simply doing and into being in the moment. Okay, along with being more mindful, can we try single tasking instead of multitasking? Multitasking is the ability to handle multiple tasks concurrently, and multitasking does have its benefits. It allows healthcare personnel to address various patient needs simultaneously, promoting a sense of accomplishment. And it can enhance time management and optimize workflow efficiency. But it also has challenges. Divided attention can compromise the quality of care provided, increase the risk of errors, and contribute to staff stress and burnout. And there's plenty of that going around right now. Patient safety could be at risk if critical details are unnoticed or procedures are rushed. It can increase the number of patients attended to, but it can also compromise the thoroughness and accuracy of that care. So with each hop between our tasks, our brain needs to kind of rest and recalibrate, which causes our focus to decline, providing an opportunity for mistakes to creep in and quality to drop. We're not fully there for any single task, making the end result, well, it's not always so good. So in contrast to multitasking, single tasking involves focusing on one task at a time. Now, this approach promotes deep concentration, allowing healthcare personnel to dedicate their full attention to each task. Single tasking enhances accuracy, thoroughness, and patient safety by minimizing distractions and potential errors caused by divided attention. It fosters a sense of mindfulness, which you all know about now, and attentiveness, ensuring a higher quality of care. Now, don't get me wrong, multitasking and single tasking in healthcare have their place. Understanding the advantages and limitations of each approach is crucial for healthcare personnel to deliver the best possible care. So it's not about choosing between the two. It's about using the right approach at the right time. But is it even possible to try single tasking in healthcare, bringing your attention as fully as possible to what you're doing? What about in everyday life? Can we give it a try since we've tried everything else? Molly, let's run that last poll. So do you think the concepts of mindfulness and single tasking might help increase compliance to IP&C practices like hand hygiene, glove use, cleaning and surface disinfection, since hand hygiene compliance is still only about 40% and cleaning and surface disinfection compliance is about 50%, despite our best efforts? I'm hoping we have a lot of optimists in the audience. Yes, yay, maybe we should try it. And I'm with the people in D. What have we got to lose, right? Excellent. Okay, so here's what we know about hands and fomites contributing to transmissions and infections. Hands make organisms mobile. HAIs are the most common adverse outcome due to delivery of medical care. Organisms are spread to patients following direct contact with those near patient surfaces or indirectly by hands of healthcare personnel. Hand hygiene compliance among healthcare personnel is at best between 40 and 48%. Gloves are the most used PPE in healthcare. Healthcare personnel gloves also contribute to pathogen transmission after touching patients or contaminated objects. Remember, gloves are single task, single use. Contaminated surfaces act as reservoirs for pathogens, and they contribute towards pathogen transmission. Cleaning and surface disinfection can remove surface contamination, reducing the risk of organism transmissions and infections when correctly performed. However, we only get this right about 50% of the time. Now, we've tried everything to improve hand hygiene compliance, glove use, cleaning and surface disinfection, to reduce HAIs and organism transmissions. We audit, we install automated hand hygiene systems. We hang up signs, we use catchy screensavers, we reward and punish, we make videos, and we educate. But somehow we're not always making the connection that our actions have consequences. We're focused on ways to improve compliance, but not necessarily on the person, we want to comply with all those things. Maybe it's time to add in mindfulness and single tasking. Being more aware and focusing on the task at hand might help us actually be more patient-centered than task-centered. With that singular focus, healthcare providers are likely to provide better care, which naturally improves patient outcomes. Completing tasks fully before moving on to the next can bring a sense of accomplishment, leading to higher job satisfaction among healthcare personnel, which is sorely needed if we're going to try to stop the flood of healthcare personnel leaving the field. Single tasking can prevent burnout by making workloads feel more manageable and less chaotic. Healthy, happy healthcare personnel focused on the task at hand would be amazing, wouldn't it? So if and when I'm a patient someday, I want that healthcare personnel caring for me to be laser focused, mindful on what they're doing right now for me and not worrying about the next task or the next patient, because you know I'm going to be watching. Thank you for attending this presentation.